Okay. Good evening, everyone. We are live and welcome to Endo Crusaders. I'm here with Dr. Vimee and Rosemarie, and it's such a pleasure to be back on this live and welcome to Endo Crusaders. Something is switched on. Okay. So as we start our session with what exactly is endometriosis, for people who don't know, endometriosis is a disorder in which tissue similar to the tissue that forms the lining of the uterus grows outside your uterine cavity. And this causes immense pain in most of the people. And it can be one of the major reasons for infertility. Sadly, the only gold standard when it comes to the treatment of endometriosis is an excisional surgery. Preparing for a surgery can seem extremely overwhelming. It can be scary if you don't know what to expect. Finding the right doctor is a task. It's a big, big task. Trust me, you ask any patient going through endometriosis, that's one of the biggest problems. You may have a lot of unanswered questions, a lot of worries that make you feel this way. So knowing what to expect before, during, and after your surgery will make you feel less nervous and more in control. So today we are here to help you go through the process of finding the right doctor, how to prepare for the surgery, what to expect, and how is the road to recovery. Hi, Vimee. It's so nice that you are here with us again.
Hi, Shilpa. It's always nice to have these conversations. And welcome, Rosemarie, to our platform.
Yeah, so today we have with us as a guest, Rosemarie, who herself is an endo survivor and is an advocate for the same. She helps create strategies for meaningful change, facilitating breakthrough results in individuals, businesses, and mission-driven organizations. Drawing from more than 15 years of experience, she's a master's and is an ICF professional certified coach. She excels at leaning into crucial conversations and providing a safe environment for diverse perspectives to be valued. She's an advocate in chronic illness space and is known for her Endo Will Not Win campaign. Having experienced delayed misdiagnosis, 13 surgeries, pain, shame, fear, isolation, she knows what it is like to not to be seen, heard, or believed, and so to say, to be invisible. Rosemarie, welcome to Endo Crusaders.
Thank you so much. I'm very honored to be here.
So tell me something. How was your growing up years?
So, I had a lot of different symptoms early on. So even before my cycle started, I just didn't put it together until years later. So, really, it started for me before I was about between 10 and 12. I started having some bowel symptoms, and then around 12 I started my cycle and just had excruciating cycles. They were unpredictable. Sometimes they'd be several weeks long. Sometimes they'd be extremely short. There would be heavy bleeding, all those things, and just horrific pain. And so that started very early on and kind of just set the precedence for the rest of my life, really. And as I was sharing with you earlier, I really didn't think that I had endometriosis, even though I was very educated about the subject. I didn't think I had it because everyone that I knew who had it was having to be homeschooled or missing out on a lot of school events and after school activities. And my family's very much of the push through anything. And so I was still very active in sports, and I played piano and all that. And so I didn't see it as hindering my life, even though I was in so much pain. And so I just, didn't associate that with, well, maybe I actually have this disease as well.
Absolutely. So when and how were you diagnosed with endometriosis?
So I started actually having surgeries when I was 16 years old. I had an emergency surgery. And at that time, we didn't think it was endometriosis. We thought that it was, I had 2 cysts the size of softballs inside of me, and one of them destroyed my fallopian tube. So already at 16, I'd had some organ damage. But endometriosis never was mentioned. The only thing that was mentioned was maybe polycystic ovarian syndrome, which I was later diagnosed with. And so, so then several years later, when I was in my early 20s, I knew something was very wrong, and I was passing out quite a bit from pain. And so I finally found a surgeon in the area that I live who claimed to be an excision specialist, however, only does ablation. And I didn't know that till after 2 surgeries with him. And in my surgical reports, it would state that they found endometriosis, but there was no pathology taken. So I still didn't have a diagnosis. So it wasn't until I then finally found another surgeon. And so it was my 4th surgery, and 13 years in, that I finally got my actual diagnosis. But by that point, when they went inside, my appendix was already dead. They saw endo was everywhere. And when I mean everywhere is they literally removed my appendix, cauterized my nerve to try to help with some of the pain, and sewed me back up and said, you need major surgery. So I had another one a month later, and there was removal of intestines. It was on my ureter, my bladder, and the gallbladder. It was just absolutely everywhere. And so it really wasn't until that 4th surgery that I actually got my formal diagnosis through pathology.
That must have been like crazy. I mean, at 16, 16 is like a really young age to, get into all of this. And 13 years that it took for you to go through a final diagnosis and a surgery, it could have been like I can imagine it must have been like a terrible journey there. Very, very painful. I can imagine.
Yeah. And at that point, like I had 6 surgeries in a year and a half, because I had one that the doctor's like conflicting in his own operative report on whether or not I had endo. So I was like, this isn't right. I need to find someone better. And so then that's when I got my actual diagnosis through surgery, had immediate surgery the next month after that. And then a month later, I started having pain again, and it was really severe. And the surgeon, I'll never forget, because I really respected him, because he took me by the hand and he just said, I can't help you. He said, I'm really good, and I didn't get it all because you're in pain. And so we need to get you somewhere else. And so, so he referred me out because of it. And it turned out it was on my kidney, and I had 2 more major surgeries, about 6 months after that. So that was a very difficult time in my life, for sure. And I thought it was over then, but then I had a lot more.
Yeah. I have a question here, Rosemarie. I see patients very frequently who have multiple surgeries. But yes, 7, 8 is very common. Like 13 is something which is a big number of surgeries. Mm-hmm. And it takes a lot of mental, you undergo through a lot of mental trauma as well. So I want to ask you, like, whenever you were advised surgery the next time, what was your mental state at that time? You had already undergone 7, 8, 9, 10 surgeries. So every time you're undergoing a surgery, you're unsure about the outcomes. Mm-hmm. So how you reacted to that, and how could you deal with it?
So every single surgery, even my very last one, which was with Dr. Sonervo at the Center for Endometriosis Care, he's wonderful, and I'm endo pain-free since then. Every single surgery, I worried, what if they don't find anything? And confirm this thought that so many doctors had told me, that I was making it up, or I just had a low pain tolerance, or, all these different things. And every single time they found something, even the ones that didn't diagnose the endo, they still found, scar tissue, organ damage, all of that. So, so the mental state, it was really hard. I had an amazing support system, but I didn't access them for a very long time because of the shame associated with the disease. But also, when I was going through all of those surgeries back to back, because it was many years later that I then had more surgeries. When I was having those back to back, I was married at the time. I was in a very unhealthy relationship. I went to all my appointments by myself. We were battling infertility on top of that. And in the community in which I lived and worked, having several kids was something that, was really important. And that's something I very badly wanted. And so all of my friends were having children at the same time that I'm having surgeries, not knowing if I'm going to wake up with a hysterectomy. And so mentally, I shut out the people that really could have supported me and wanted to be there for me. They tried to be there for me, but I really did just kind of power through by myself for a very long time. I did eventually seek therapy. It was going into my 5th and 6th surgeries, because here I'd found this doctor in Houston that finally, had diagnosed it. It was in pathology. He, had removed so much, and then he couldn't help me. And that was when I was like, it was just very overwhelming. And so I did seek some, mental health support, and that was crucial, because I didn't really have that support elsewhere. I didn't really have it in my family. Those that had faced endometriosis were pretty scarred from it, and so weren't very open about their story as much. And I just didn't want to be a burden on others. And so, which you're never a burden on others, is what I've learned over years and years and years of really tough emotional work. But it's like you have this grit, like we all do. We all have this grit to power through, but that's not always the best thing. And so, so I actually had gotten a tattoo to represent my journey right before I thought I was going in for my last surgery. And this was surgeries 5 and 6. And it was to represent the end of the journey. I'm finally going to, one of the top surgeons and all of this. And so then, and I was pain-free for a couple of years, but it wasn't the top surgeon. It wasn't a good surgeon. And I ended up many more surgeries, later. And then I realized over time that it doesn't matter that it doesn't matter if they don't find anything. It doesn't matter if, that it's just the next diagnosis, because then you also end up with other illnesses a lot of the time as well. And so and what I mean by it doesn't matter is it just is. Accepting that this disease has no cure. And so, and that's hard to accept, because the gold standard of treatment is excision, and you will be better off, but it's still a change. It's still not 100%. It's a new normal that you're adjusting to after surgery. And so from a mental perspective, I used mental health support. I'm a coach, and actually I found coaching quite helpful also in helping me come up with some of the answers on my own of how do I build my community of support? How do I, knowing that this is an adjustment for life, how do I need to set boundaries in relationships, and so that I'm clearly communicating to others what I need, and then actually accepting the help when it's offered. And so it took a lot of time and a lot of work, but I wasn't always in that headspace. There were many of those surgeries going in that, I had the will to live, but it was very defeating a lot of the time, because it was like yet another one, yet another one, yet another one. So I understand and still can taste that, that hasn't left me, even though my mindset has changed. But it took a long time, and it really was after I almost lost my life in one of my surgeries. It was my 12th surgery. I had a total hysterectomy, and it was kind of like the storm of everything that could go wrong did. So I was healing really well from surgery, and already it was a very traumatic, emotional thing for me. But I had an allergic reaction to Dermabond, which they used to seal the incisions, and it was quite bad. I had 2nd and 3rd degree burns, and they then, had treated it with a steroid and Benadryl, and we didn't know at the time I'm allergic to Benadryl. And so I was taking Benadryl for like 10 days. And then by the time I end up hospitalized, they then put Benadryl in my IV, and I almost died. And coming out of that, I was in the hospital for months. I was down to 95 pounds, having to learn to walk again because I had no muscle mass, and it was a really tough point in my life. But that's when it finally clicked that I may be having more surgeries. This was my 12th one, yes, I may be having more surgeries, and I may have more diagnoses, but you know what? It just is. And because it just is, that means I need to just live life and try to live it to the fullest that I possibly can, even the days that I'm stuck in bed, even the days that I am just so physically exhausted. I can still live, I can still contribute, I can still be the human that I am, and love others, right? And so it may look different every single day, but I can still be. And so that was, it took me a long time to get there, but that's then what really shifted things for me, was that acceptance.
That takes a lot of mental strength. I'm sure that takes like a lot of mental and emotional strength to reach where you are right now. It's not an easy journey.
No.
So
and it's okay to be wherever you are on the journey.
Absolutely.
Like, that's the thing. It's okay.
Start where you are, but you have
exactly.
You have to. So
yes.
Endometriosis is not the only thing that it is. It's a complex thing. So what other medical conditions besides endometriosis are you suffering from? What's the impact of endometriosis and the associated conditions on your life?
Yes. So as I shared, my first surgery, I had cysts and endometriomas. And so I did also have a diagnosis of polycystic ovarian syndrome. Unfortunately, a lot of the things like diet-wise and things like that you do for PCOS is the opposite of what you want to do with endo. So that was a constant battle for years, trying to figure out like which is the lesser evil that makes my body feel better. And so I had that. And so when I wasn't in the OR for endo, I was in the OR for cysts. And because my cysts would grow to surgery size in one cycle. And so for about 10 years, I was doing progesterone injections. And by the end of that, they were solidifying under my skin. And the scar tissue was so bad in that region, in like the lower back, upper glute area, And so we had to stop. It wasn't even absorbing. And that's when I decided to have the oophorectomy, because that was the only way to keep me from having so many other surgeries. And then we discovered that I had possible adenomyosis. So that's why I also made the decision, because of having so many surgeries as well, my body just could not take much more. And so that's when I decided to have the total hysterectomy instead. And then on top of that, about a third of the way through my journey, after I was diagnosed with endometriosis, I was married, I was trying to have children, and we were having a really difficult time. And I knew all of the risks and side effects of Lupron, but and I'd had family members on it before and saw how it changed their life for the worse. I have someone on disability even because of the drug. And I was so desperate that what if this happens to work for me? And of course it did not. After 3 injections, I actually then got medication-induced secondary Raynaud's. So what that means is my fingers actually started turning black. And so they immediately stopped the injections. And ever since then, I've had secondary Raynaud's. And so that means that I can't withstand the cold. And sometimes that can even be as low, like it can be as high as like 68 degrees. It's just depending on my circulation at the time. And so sometimes my extremities will turn white, they'll turn black. It's very painful. You get really bad neuropathy from it, and like pins and needle feeling and sharp edges on your extremities. And once it starts occurring, it's really hard to go back. So that's kind of all of the various things that have occurred. And then, they did remove lower and upper intestines, and it was right at the ileocecal valve. And so it's taken me over 10 years, but I've finally figured out a diet that actually works for me, that I don't have to be on medication. They told me I'd be on medicine for life, and I'm off all medication. I only take, supplements and things like that. But, that gave me a lifelong thing to adjust to, and figuring out what I can eat so that I'm not ill. And they removed the section of my intestines that absorbs B12. So I also have to make sure that I'm supplementing that as well. So a lot of lifelong adjustments as a result. But as far as actual illnesses, it's the secondary Raynaud's, PCOS, adenomyosis, and then due to the inflammation, it has scarred my heart. I've had some lung damage and things like that as well. So they're
crazy to handle. You are talking
and
about
angiomyopathomas.
I
found that out a couple years
as a matter of fact, but oh my God,
we'll just add to the checklist.
You are amazing. I must say, the kind of power that you have in you, I think it's amazing. And I think there's another thing that I read in your post, insomnia.
Yes, right now, and that's due to hormones. So, so I had my hysterectomy 4.5 years ago, and because I was hospitalized for so long and I had that severe allergic reaction, even when I ingested water, it would turn to acid. So they couldn't give me anything. So I then went through menopause, but with no hormonal support, which is common in someone who's battling cancer and things like that. But it was fine for me for a little bit, but then I started getting really severe hot flashes that just really were not manageable. I wasn't sleeping. So I did go on estradiol for a little bit, but I knew I wanted to do the bioidentical hormone journey. just because I really try to make sure that I'm putting good things in my body because it's already battling so much. So I just need to take care of it. So, but I was going through so many adjustments and having to find a new diet and find like all these different things to get myself back on track and feeling healthy. My version of healthy, right? And so, but then by December of last year, it got so bad that I was like, okay, I need to actually pay attention to this. So I just started bioidentical hormone therapy through pellet form. And that in itself is a journey.
I know.
So I can't sleep. Yeah, I haven't been able to sleep.
So that was one of the biggest problems I had. I mean, similar to how yours was, I had to go through a resection of my intestine and a complete hysterectomy. So having food and digesting it yeah, and sleeping are two major issues. And I can't go through HRT because of my migraines. It's terrible. It's like terrible. So I can imagine what you must be going through, and to find your own solace, to find the treatment that suits best for you it's a journey in itself, complete journey in itself.
It is. It's overwhelming. And we do talk a lot about having a multidisciplinary approach, right? You really want to have a team of people that are supporting you. So you want your excision surgeon, but you may also need pelvic floor physical therapy. You may also need a gastro doctor to help you. You may need a dietitian or a functional medicine doctor. I get myofascial release because I have so much scar tissue from all the surgeries. It's actually formed like my muscles, some muscles aren't forming and aren't working because they haven't had to work. And so we're trying to they were kind of trapped by the scar tissue. And so we're trying to use myofascial release to help that. Acupuncture, like I have a long list of my team. But one key to that is you have to also concentrate on what is my highest priority, what's coming to the surface the most right now. Because if we are doing 3-4 appointments a day, I did that and my mental health just went
absolutely,
even though my physical health was starting to, but then once my mental health started going, then my physical health went down too. So I had to learn the hard way that you just have to prioritize. So, I'm in pelvic floor physical therapy right now. So when I have that, my myofascial release, I tell them you need to do like half of what you normally do because my body just can't manage all of that. But the diet alone, I really feel for you because that took me over a decade to figure out what foods really work for me and what don't. And I know that could change. I know that I could find that and then a year from now something shift and I need to change that. So, but for right now, it's been 2 years and I'm off all meds and feeling better from that aspect. So it just takes time.
Absolutely. So Vimee, so somebody who has to go through an endo excision surgery, what should be the preparation like? What should one be prepared for?
Yeah.
So, as far as preparing for surgery, so it depends if you're traveling for it or not as well. But first off, you want to make sure you're actually matching with a doctor who's doing excision. And I can't tell you how many patients have come to me and said, I'm in so much pain. What if I just get ablation in the meantime before going and getting excision? Because there's such a long list for excision. And I've had ablation done unknowingly and it made me worse. So I ended up having excision soon after. So another round in the operating room is not what you want. Trust me, I've been there, done that. So finding an excision surgeon that you trust, that speaks truth, that knows the correct definition of endometriosis and treats it as such is really important. But as far as prepping for excision itself, making sure you have that support system. So even if you don't have close family members or friends, if there's a church organization or there's a lot of endo support groups that you can find that are local, and people really come together and they'll make like little care packages and things like that, or come and check on you, or things like that. But if you do have a support system in place, prepare them. So I know oftentimes we can be ashamed talking about surgery, and we don't want to tell them what kind of surgery we're having. And that's okay. You don't owe anyone anything. You don't have to tell them the type of surgery you're even having, except for the very close group that's going to be supporting you more one-on-one. But like my last excision, I let my neighbors know, hey, I'm having a surgery. I'm going to be out for like 6 weeks. I have to travel out of state. Can you just check on my house? Can you walk my dog? Can you take out the trash every once in a while? Like, so they didn't need to know the details or see me, but they were able to support and take away some of those little things that then the people who were needing to cook meals and help me walk and, all of those things and travel with me, they had less things to worry about, because I tapped into a greater support system to help with the other things, which I think is really important, because we don't want to burn out our caregivers either. And so really I made a spreadsheet of all of the different, like really sat down with what are the things that I need, what are the things I need to purchase? Do I have clothing that's appropriate for recovery? So I prefer like flowy dresses or dresses that don't have any waistbands or chest bands, because I also had VATS procedure in my last one, because you don't want anything rubbing on the incisions. Making sure you have underwear that's a size or two larger, because you're going to swell. Now, if you already have endo belly, you might already have the the right, thing for that. But really thinking through your meals. If you can prep and freeze any of your meals ahead of time, that's a huge help, because a lot of people may want to make things for you, but they're not things that you can eat. If you ask people to make meals, make sure you're very clear on what you can and cannot eat, so that you don't get sick. Make sure that someone that's traveling with you is someone that you really trust and that has the empathy and compassion to care for you, and confidentiality, like that they know how to handle. I would have like group texts that I would create ahead of time, so that this was the group that got the very specific information. This is the group that just knows that I came out okay from surgery, right? And made that really clear with whoever was communicating on my behalf what I wanted communicated. Another thing is to prepare like Netflix lists, music. I really am a big music fan, and so for my healing, and so I create ones that are calming to me or that just fit different moods. And it really helps when you're in the hospital, because you don't hear all the beeps and all the strange noises and things. You can just kind of sink into the music or podcast or whatever you enjoy. And it's a nice distraction and calming thing. But those are, some of the big things. If you are traveling, really don't be ashamed to use accessible options. So call the airlines ahead of time and ask for transportation between gates if you have to change gates. Ask for a wheelchair assistance and, things like that. Whenever I've had to travel, I make sure that I find a hotel or an Airbnb or a home that doesn't have many stairs, that that has a little kitchenette so that I can have home cooked food and not have to eat takeout, things like that. And if I don't have the ability, so a couple of my surgeries, I drove and it was a couple day drive. It's not fun. Making sure that you're preparing meals for that. And if you don't have the capacity for that, then go a day ahead of time before all your pre-op appointments and go grocery shopping and get what you need and get settled, because that just really helps. And explore, have fun in the city that you're visiting. Try to do something distracting and neat, and then that way you're exploring, but then you go into surgery. It just really helps with the mindset a lot. So
I think this was really helpful for people who will be traveling for surgery. I think these are really, really good tips. Dr. Vimee, this is for you. What are the red flags when a patient should seek another opinion? And also what can a patient expect post-operatively? Complications and anything like that?
Yeah, Shilpa. So, Rosemarie, that was very helpful for patients who are preparing to travel. Shilpa, red flags, patient when they are conversing with the doctor, there are some indications which can be considered red flags, and they should seek a second opinion. Suppose their treatment plan is not working for them. If they share with the doctor and they aren't ready to listen to them, that is a red flag, and you need to consider another opinion. Correct. You should make sure that you are a part of the treatment plan, and that's only possible if you are well informed. So patients should be well informed. What is the excision surgery? What are the complications? What is her organ involvement? What radicality of the surgery will be done for her? So these are the things which a patient should know. Then only she can be a part of the treatment plan which we devise for them. Correct. That is also a component of consent and informed consent. So informed consent is very, very important for excision surgeries. And if you are told you may not have endo as all your reports are normal, definitely you have to seek another opinion. If you are pushed towards medication and are told excision surgery causes complications, it's a big red flag. Most of the surgeons or gynecologists who are doing ablation or fulguration, they will counsel the patient that excision surgery may lead to bowel leak, they may cause ureteric damage, so it should not be done. So these are major red flags and hurdles where you should immediately seek another opinion. If you're suggested a hysterectomy, even though you don't have adenomyosis, for endometriosis, hysterectomy does not work. And that's an indication where, again, your gynecologist is not advising you correctly. And if you are told that after menopause, endometriosis disappears, you can carry on like this. In few years, you'll be menopausal and your symptoms will disappear. So that's a very, very big red flag, and you should immediately opt for another opinion and seek another advice, because menopause has nothing to do with endometriosis. Menopausal women may have endometriosis. After hysterectomy, you may have endometriosis.
I did.
True, absolutely. And another red flag which I feel is when a gynac tells you get pregnant and you will be fine.
Yes. So get married and get pregnant if you're told like that. So please immediately.
That's like a very, very big red flag. You know?
I was given a bottle of red wine by a doctor.
Oh.
And he said, go relax and you'll be able to get pregnant and your endo will go away.
Oh, that's really like.
No, that's what I'm saying. See, so there are things which you really have to, listen very carefully when your doctor is talking, because you have to catch hold of those subtle, things that they talk. You have to be very smart.
Here's some red wine. That'll
Very common advice: get married and get pregnant, as if women are baby factories. Nothing else they have to do.
Wow.
So
yeah. And I love that you mentioned informed consent. I think that's something that, really understanding that they should be giving you all the risks and the alternatives to whatever they're going to be presenting to you. So even if it's an excision surgeon, I sat down with Dr. Sinervo, and who's like best in the world, and he still gave me the rest with the surgery and the alternatives, and they're not good alternatives and they're not really alternatives, right? So but he gave those to me because that is my right as a patient of informed consent. And
so
I
when a
think that's
patient
really
walks
important.
in, we just cannot say that I will do excision surgery. I have to tell them these are the treatment options available, and this is evidence-based, this is scientifically based, these are the success rate, these are the failure rates. Then the patient has to decide. It is her
Right.
body.
That's true. That's true completely.
Oh no, you froze.
Hello.
Looks like she froze. She might have to pop back out.
So, Vimee, can you just tell us what complications can happen after an excision surgery?
I think Vimee's.
She's not there. We
Let's,
lost her, it
I'm
seems.
going to put it in
it's
the
okay.
chat.
It's okay. No problem.
Oh, there we go.
Yep.
There she go. Back.
Okay.
Live, Shilpa?
Yes. Yes. So I was just asking you that can you just elaborate on the complications that can happen after excision surgery?
Yeah, so I would just brief on what to expect post-operatively after excision. Sometimes patients do think that excision is a magic wand. They will get the excision surgery and next day they'll be all right. So do not expect like that. Excision is just the first step. And there are a lot of changes which you need to incorporate post-operatively, diet changes, pelvic physiotherapy, meditation, yoga. For some, acupuncture helps, myofascial release helps. As Rosemarie already told, she shared her experience, how she modified her dietary things and she could understand over the years that what suits her well. So these are multiple changes which you need to do post-excision. Now, post-operatively, what you can expect is, usually on the day of surgery, we admit you to the hospital and there will be overnight stay and you will be able to go home next morning if it is mild to moderate excision. If you had a more difficult surgery, your stay may extend from 1 to 5 days or 5 nights. First 24 hours after the surgery, patient may feel a little drowsy because of the anesthetic effect. Mostly we use anesthesia, which are long, short acting, but still you will be a little drowsy and you'll feel sleepy. You may find tubes, one from the urethra, that is for the bladder drainage. If it is a short interval surgery, immediately after the surgery, we remove it so that you ambulate post-surgery and recover faster. But if it is moderate to severe kind of excision surgery, we keep the indwelling catheter for at least 24 hours. Now, next morning, we remove it. If the surgery is more extensive, catheter we may keep for a longer term, or for the bladder excision, we keep for even 2 weeks. It depends on the type of surgery and the excision done. Mostly you will pass urine normally, but if it is removed, it does not delay your discharge home. But in some patients, they may find difficulty passing urine. And very rarely you may have lazy bladder syndrome when there is extensive surgery around the bladder. There will be 4 or 5 cuts on your abdomen. You may feel little sore about it and you may feel little discomfort, mild pain there. And there will be waterproof bandages on those cuts. And you can have bath and shower the next day. Nothing happens to those. We usually use absorbable sutures, which need not be removed. But if one has to be removed at the follow-up visit, they can be removed easily. You may experience slight spotting or vaginal bleeding after the operation because of the manipulation in the uterus, and we do hysteroscopy in some cases. It settles spontaneously and does not interfere with your normal periods. Now, if we talk about the complications, in general, the complication rate after laparoscopic surgery is around 3 to 5%, but it may be as high as 10 to 22% where the colorectal resections are involved. Now, a patient may have minor post-operative complications and they can be managed conservatively, like you may face mild fever, a little more pain, urinary infection, abdominal pain, voiding difficulty, urinary retention. So you may need catheterization again sometimes. Sometimes there may be a pelvic abscess or a mild pus collection, but can be treated with IV antibiotics. Blood collection can be noted sometimes. Surgical site bleeding can be there. Redness, bleeding, and there may be swelling and redness near your intravenous site through which we give the IV fluids. So these are the very common things which you may encounter in the immediate post-operative period or next over the 4-5 days of your surgery. And they are treated conservatively. You should not panic about it. But there can be some major complications, which just I'll mention the names. It is nothing to scare you. It all depends on the type of surgery and type of your endometriosis and the excision done. There may be some chances of leak following the major resections done, rectovaginal fistulas, vesicovaginal fistulas, ureteric stenosis, and sometimes hematoma, which may require relook laparoscopy and evacuation of the blood clot if it is too big in amount, or if it is interfering with your, it may cause severe infection if we leave it. Sometimes in hysterectomy cases, when the resection of the vaginal wall is too much, there can be necrosis of the vaginal apex as well. So these are rare complications, and complication rate usually depends on the center, and high volume centers for endometriosis usually have low complication rates that you need to understand. So those who are doing regularly excision surgeries, these complications we face very rarely. But yes, every case is different. No, one size does not fit all. Every surgery is different.
That was like really helpful for me to know about what you can expect post-surgery. So Rosemary, you yourself are a coach, right? So how did you
Yes.
become one? And can you tell us a little about your most recent endeavor?
Yes.
What's your goal? The main goal behind it.
I'm so excited.
Yeah.
So I've been a coach for, gosh, over 10 years. And I started off actually in the nonprofit realm. I worked in HIV/AIDS and in the educational space. And then it led me to then doing education for leaders. And I started studying behavior change and, what actually helps individuals, make major change in their lives, and how that affects greater organizations. And so I got my master's in organization development and leadership. And that's where it further cemented how important coaching was. And because we actually had several classes that were focused just on coaching. And that's when I decided I wanted to have the same level of credential in the coaching space as I had in my other professional work. And so that's when I became a credentialed coach through the International Coaching Federation. Not all coaches are the same, just like any profession, right? Like not all doctors are the same, not all excision surgeons are the same. And so it is really important when you're looking at coaches to make sure that they have some form of credential, not just a certificate. And that they even have a certificate, because a lot of them don't out there that are endo coaches. But a year ago, I had been just working in the corporate space and large organization transformation space for a long time. And then I was really seeing a need in the endometriosis community, as well as the greater chronic illness community. And so I started Endo Will Not Win, actually from my hospital bed years ago. It was just a hashtag that I had used that kind of was an accountability for me that endo will not win. Like, it doesn't matter if I'm walking like a turtle right now. It's part of my recovery post-surgery. Like endo will not win. And so last year I actually made it more of a reality. And so I started my Instagram account and just brought coaching and those types of questions and things to help you be able to dig a little bit deeper and to heal like your emotional aspect of dealing with this illness, of dealing with illness in general. And then I started piloting a bunch of different programs and small coaching groups and things like that, because coaching's not cheap either. It's not as accessible as I would like it to be throughout the world. And so my most recent endeavor is that I've been piloting things for a year, and now I'm ready to launch a platform next month. And it's, basically it's twofold. So one is that it's a platform that will have information around endometriosis. It will be directing to correct resources and experts throughout the world. But it's really meant to be a community for people to learn together and go through small group coaching sessions on various topics for unpacking ways to heal their relationship with themselves, with their bodies, with their illness, and with others. And so there'll be like small group coaching series, like I'm kicking off one on self-care and what that really means in the chronic illness world. That kicks off next month. I'll be doing retreats, both virtual and in person, because taking care of ourselves, having that time out is really, really important. And just really taking care of you is a really crucial thing. And I'm going to be offering sliding scale scholarships as well, because I truly believe it needs to be accessible. We are our best advocates when we are in the right mental space. And so it's really hard to advocate for yourself with your doctor or with anyone on your medical team or with your family, or setting boundaries if you're really struggling with where you're at. And so that's what I'm trying to do, is try to help people feel more empowered and have the right tools to be able to unpack this grief and to bring the illness in versus shove it out. And so I'll be launching that space next month. But then I'm also building a component where I am building a course that will be for CEU accreditation. I'm going to start with coaches, because I think the people who are supporting those who are chronically ill need to really understand all of the nuances that come with being chronically ill. If they may see it in their clients or their patients every day, but really truly understanding the day in the life really helps bring some perspective as you're then going to support that other human. And so I'm working to make a course accredited for CEUs for coaching. I then will tackle therapists and then the medical field as well as my goal. So that way doctors would be able to get CEU credits, and pelvic floor physical therapists and all those who support us in better understanding what our path might have been like before they walk in the door to meet you. So that's my new venture, and I'm really excited. So if anyone is on Instagram, I wanted to mention that in my profile, there's actually a free downloadable packet around that has like links to videos and resources around endometriosis, but there's also like a what to pack list for your surgery and things like that as well that can be helpful. But then there's also a link to the current community that will then be shifting into this new platform next month. So
we are super excited too. I mean, it sounds like an amazing project that you have taken up for the endo warriors and anyone who's suffering from chronic illnesses. So any parting words that you have for our viewers?
To anyone with endometriosis or any chronic illness, you are not a burden. You are not a burden. Your pain is so real. And like, you just really have to trust your gut and really stand in your truth, what you're feeling, and trust your body, that it's telling you that something's very wrong and it needs help. And so listen to it. You are so worthy of good care. You are so worthy of excellent surgeons. You're worthy of being believed. And, if you really do believe that and really stand in who you are and listen to your body, then endo will never win.
That's amazing. So Dr. Vimee, one last question for you. Any tips for patients traveling for a surgery?
Yeah, as a doctor, what I would say is it is worth traveling even across borders if you're going for an expert surgery, because it's better to have one good surgery rather than having multiple surgeries and ending up with no relief. Make the right choice when it comes to selecting the center. How to select the center? Best is to talk to the patients who have been operated with the same doctor. So get the feedback, how the process goes, talk to those patients because they have gone through that process. So they will be able to help you out much. And because there is a lot of misinformation even on the internet. So you need to get the right resources and right information. You can ask them questions, whatever you have in your mind, why, when, where, how it happens, how the process goes, pre-operative, post-operative care, everything. I think patients are the best ones to answer, like Rosemarie has explained it so well. So if you're planning to go to some certain center, get in touch with a patient who has been operated. And definitely every case is different. As I always say, that their recovery may be different from yours, but you will get an idea how the system works there. And it is always advisable to have a teleconsultation with your doctor and then schedule your visit if you are coming from out of state or out of country, because it's not possible that suddenly the patient comes and they ask for the surgery in a day or two. There may be a waiting list for the doctors. So you should always schedule that teleconsultation, schedule a date and inform them the date of arrival and how many days you will need to stay in the same city for the follow-ups as well. You should ask them how many days pre-operatively you should be there for evaluation and discussion and post-op stay in hospital and outside as well. Also connect with their office for the insurances and the financial things involved. That is the most important aspect of it. So prepare yourself accordingly and then you should visit for the surgery if you're going it for surgery somewhere else from your place. So these are the tips as a doctor. Like we feel that patient should connect to us first. If you have any reports or imaging results, share with us. We'll have a look at it. As much as possible, we will try to advise over teleconsultation that this will be the plan. But once you arrive after the physical exam and the pre-operative check, we can give you a detailed description what your treatment plan will be.
Absolutely. That was like amazing. So this session has been like really, really helpful. And I'm sure this is going to help a lot of people who are planning on their excision surgery or who are planning to travel for a surgery and to a different place. So thanks, Rosemarie, for coming to our platform and and helping so many endometriosis patients. And Vimee, thanks again.
Thanks, Shilpa. You were amazing. Thanks, Rosemarie.
And thanks to all our viewers who have been like so supportive as always. Thank you and have a lovely evening ahead. Bye-bye.